right, it is 8 o'clock. And we are at the intersection. I meant to look up to see how many times we've met in the last 3 years. But it's been a bit, every Thursday except for Thanksgiving. So some important announcements this morning while more people gather in these first 5 minutes. And I'll be sending out some of this information. On October the 6th, it's a Friday, from 8 to noon, there is a prayer time and multi-faith symposium that's happening. The conversation is happening between faith and community leadership and the Fusion Center here in San Antonio. If you're not familiar with the Fusion Center, people who work there in collaboration together include the FBI, the San Antonio Police Department, the Fire Department. So just think of all of those, and Homeland Security, they all collaborate in the Fusion Center. The community conversation that day will be on violence in our community. So that information is coming out, and I hope you will mark your calendars. I can put information into chat, but that's an important coming up that I wanted you to all know about. Are there other short announcements of upcoming besides from our conversational list this morning? Announcements.
Yes, I have something. This is Donna.
Hi, Donna.
Hi. I wanted to announce that Bridges to Care is partnering with some congregations in District 2 to do a suicide awareness event on September 30th. Starts at 9 o'clock. It's going to be at Second Baptist Community Center. And we just invite the community. It's a free event. I'll put the information in chat. You register via Eventbrite, and we're looking to actually have conversations. So we invite everybody to come out to this event, September 30th.
Thank you, Donna. If you go for no other reason, well, the reason you should go, or we should all go, is about suicide prevention, because those numbers are way up. But if you've never been to the Second Baptist Community Center, there's a go-to to explore.
Yes.
And they have a bowling alley, and yeah, also, you know, it's a community center at Second Baptist. Another announcement, maybe, what's coming up? And I know Doug is just dying to talk about the NAMI walk. So we're just going to jump there because I know he's just waiting to do that. So talk about forming a team. There's a good thing to talk about.
Okay, October 7th, Saturday morning. It's always a beautiful Saturday morning, that first Saturday in October. We have the 14th annual NAMI walk, which is to support better mental health care. And it'll be at the San Antonio Zoo. It's simple. All you have to do is go to the NAMI website or go to namiwalks.org and sign up a team. Sign up to register to come out to the walk. It is a fundraiser. We need for people to form those teams and to use that as an opportunity to ask people to support NAMI and better mental health care. So it's a great opportunity to visit the zoo, bring your kids, bring everybody. And it's one of the best things about the event is it's the whole community. I mean, you get out there and you think, wow, I had no idea there were this many people who are interested and care about mental health. So we invite everybody to come.
Oh, great. And look at that. Somebody has put the Sacred's going to have a team working there. So, yeah, make a team. I'm working on one from the Department of Human Services. See what happens with that. One more announcement, and then we're going to jump in. Or not. People are putting things into chat in terms of announcements and things to go to.
Yeah, I was just going to say that. And
so
good morning.
Sure, yeah, make sure you do that. Put your name in there. And so today, we're going to do something a little, we're going to do it a little differently, I think. In my head, we are. We have 3 efforts and organizations coming together today in this conversation. And even if you haven't been at this intersection a lot, it's not rocket science to figure out what each of these 3 do. So today is not as much about what they do, but how they partner and co-labor and why they do so together. So it gets us into the why of collaboration, and then also finding out in the conversation where their needs are and why they need more partnership from one of the other 2. And so I hope our speakers have been listening to what I'm planning, but basically this is how a co-laboring meeting works, right? What do we need? What are we doing? What could we be doing more of together? How can we strengthen each other? I do want to say this. So Amy represents the Workforce Development Office in the city. Workforce development, jobs, right? Again, not rocket science. That's what they work on. And they're on the webs. So you can go look at all the different things they have to offer. They recently received a national award for their collaboration. Right, Amy?
That's right.
For their collaboration and what they're doing in San Antonio. And that collaboration award was across all, different organizations and how they're partnered together. Sacred.org, Bill, was that like a year ago? Not quite. Where the Alamo branch of social work, Sacred received an award. Can you explain that one?
So for about a year, we've been participating with Workforce Solutions Alamo in their vocational rehabilitation program, where we are able to hire individuals mostly with disabilities that are trying to re-enter the workforce. And so they come to work for Sacred for 12 weeks, and we teach them how to do resource investigation. And it's a great job for them because they can do it from home, and we don't require them to go to an office or anything like that. And so we were just recently last month nominated by the Workforce Solutions Alamo for the Governor's Award, recognizing nonprofits who have a program for hiring and using employees that have disabilities and making accommodations for them. So we were just nominated for that this month, but we've been on the program for about a year, and I want to say we've had maybe 8 people that have come through the program. Keith would know for sure, but I think it's about 8, and one of them we've hired to work for us, and we are hoping it's not done yet, but we think we'll probably be hiring another one in the coming months.
Wow. And I was asking about the social work award.
Oh, that one, yeah. So
that one. But when you look at Sacred itself, it's one big collaboration. So it's all resourcing all the different entities, and Pathways to Hope, part of NAMI Bridges to Care. It's become the national model, Pathways to Hope, as well as Bridges to Care, and how we're forming cohorts and geographical proximity congregations. Many of us know all these things. So now I'm going to open up the conversation between the 3 of these folks. So the first question that might be helpful to everybody is, how are you already linked to each other? How are the jobs and mental health and community resourcing, these 3 entities in particular, how are you already co-laboring? So I'm going to leave that open for whoever wants to go first.
So I can start with that. So just to give everyone a little bit of background on Ready to Work, it's a citywide, voted on, approved by 77% of the voters to allocate $200 million of our sales tax toward giving access to people to go to that next level of education. So wherever they start, then we can take them about 2 years later in their educational pathway. And we can do it in a free way, and we provide wraparound services. We assess them at the beginning, understand what are their needs, and then connect them to people who can meet those needs. So there's the first co-laboring that Ann is talking about. We have this, we follow the Alamo Area Community Network Prepare Assessment. So that helps us understand, are people safe? Are they hungry? Do they have food? Do they have housing? That kind of thing. And we understand their basic needs. We get those basic needs met by connecting to people in the community. We're not trying to duplicate efforts with what's out there. We're trying to connect. So sacred.org is one perfect example. People can go look online and find that connection and make it. And then we also have the 211 network with United Way, where people can refer people within our system to those agencies, and they can close that loop. So that's the first thing we're doing. Secondly, and Ann talked about this with the collaboration, one of the reasons why we won that Sharman Stein Award was because we're intentionally reaching out to the people who need us the most. And we have these community collaboration, champion collaboration concepts where we go and we focus on a particular issue that our participants may be facing. And one of those issues is mental health, for example. So we had NAMI counselors come and talk to our counselors and explain to them, here are some signs that you may witness from your participants. Here are some things that you can do to get them immediate help and longer term help. So not only do we focus on mental health, but we also had one on housing where we connected them with people in the community, that kind of thing. So, so our instant connections are intended to help our participants succeed all the way through our educational program, and then eventually get a job, which is where they're really gonna benefit. And then I can pass it over to Doug and to Bill to talk about, you know, the mental health needs of people who are going through this process and then in the workplace.
I love that, having the counselors too. Even when you start to think of co-laboring, there are small pieces that really make the difference. And that's a really good example. Bill or Doug, your connections with the three of you.
Well, I think Amy just mentioned, you know, visiting.
Hang on a minute, I'll just mute. Okay, Doug, go ahead.
Well, she just mentioned NAMI visiting and working with the staff, which is certainly an important area. And Donna Costa and Emma Alexander are on the call, and they can speak to that probably better than I can. But I think the area that I wanted to bring up today, that where we need more collaboration and engagement, is in the workforce for people that work in the area of mental health. There's a significant shortage, not just in our community, but across the country. And what we have been talking about through the Bexar County Task Force on Criminal Justice and Behavioral Health, we have a subcommittee that deals with issues like housing and employment. And we know that we need to find ways to fast track getting people ready to work in mental health. We can't wait 10 years in the pipeline for people to come out the other end with mental health related expertise. We need it now. So one of the things that I'd like to visit with Amy about is programs that would work. And we're talking about getting people certified to become licensed professional counselors. Excuse me.
Bless you.
Clinical social workers, marriage and family therapists, but also to get people into this psychiatric nurses. There's a big shortage. So these are programs that people can get into relatively quickly if they have some educational background. Amy, how do we do that?
So you're talking to the right person, because I oversee the training catalog, and we have about 1,000 courses that people can take all throughout the community. So if you think about all the colleges and all the training providers that are in the community, as long as they have a course that relates to one of our target occupations, we have 81 target occupations that are identified as well paid and in high demand. And those include community health worker. It also includes nurses. But these specific credentials that you mentioned, I have to check, because there are 81 different credentials that we have. I don't have it in my mind, but I can check to see if they're already in, and if they're not, then we can bring that up to our advisory board, and they review our target occupations every quarter. And then if we get one approved, then we'll add courses that align to that target occupation.
See,
That's-
there's a great
First one,
step with
first one.
collaboration, right? Meeting the needs. So Bill, tell us about the connections from your direction.
Yeah, sure. So I think, the first obvious collaboration between Sacred and these two organizations, and as well as everybody else that's represented on the screen, is that the people that Sacred serves are the same people that NAMI and Ready to Work are serving. There are people in our community that have a need, and they're looking for a resource that has the capacity to meet that need, very simply doing so. So those are the people that Sacred is attempting to be of assistance to. Often we find that the way that we reach those individuals who are searching for assistance is through organizations like NAMI and Ready to Work. These are that have staff that are engaged as part of their job or part of their vocation on helping people connect with resources. So Sacred is really where if somebody comes into the Ready to Work program and they've got these tremendous job training programs and so forth, but what they really need is a ride to school every day, right? And so that's not necessarily something that's in the Ready to Work program. Sacred is the answer to that. That's where the Ready to Work counselors and people can go to assist their clients. And when early on when Ready to Work was forming, we actually engaged with them, and we went through and connected with every one of the Ready to Work enrollment points. And every office where there were counselors and I'm sorry, Amy, I don't remember what the term is for that position in your group, but that were in the navigators within the Ready to Work program. And we talked to each of those places and offices, introduced them to Sacred, made sure that we had listed the Ready to Work programs that were being offered there, as well as making sure that those individuals were aware of what Sacred is and how they could use it to further that mission. Similarly, with Bridges to Care through NAMI. NAMI has been a huge collaborator and partner of Sacred over the years. As they started their Bridges to Care, we knew that these individuals that were in faith communities were going to need ways to find mental health resources, as well as everything else that individuals need, which was the birth of the mental health portal, which was kind of our very first attempt to really take Sacred to the next level, which we have now replicated 3 times and planning 2 more on 2 more projects of that scope. So that so those collaborations go way back to the beginning, years and years of time and energy. So I really think that Sacred exists so that these organizations can spend more time on their primary mission and less time looking for phone numbers in the community, because they can just come to Sacred and get it all. So we've done that work one time so that all of these other organizations can benefit from that, spending more time making their own navigators and counselors more efficient.
And
so
if I may, could I add just one more thing? So not only have we had NAMI and other groups come to us to talk to our counselors, we've also been privileged to be able to speak at like a NAMI event, for example, that brought together all of its community members so that we could share the Ready to Work opportunity with the various nonprofits and with the people who are doing the Bridges to Care. So it's a two-way street, because we know, just like Bill said, we know we're all serving the same people. So how do we get in touch with those people? We use those networks that are already existing out there, and we use the trusted counselor to refer them to us, because that way they're going to walk alongside them and say, yep, you can do this Ready to Work thing. Let's go together. And we have a nonprofit incentive. So if any of you are interested in sharing that with other nonprofits and with your own, we can pay up to $3,000, $100 for every person you refer to Ready to Work that is eligible and enrolls in courses. So just wanted to make sure that y'all are aware of that too.
So I've got 2 next questions. So has a job portal, I don't know what that would be called, has that been discussed with Sacred? There isn't a portal for that yet, is there, Bill?
No, we don't currently have a job portal. We do have a subcategories around various work-related needs. So, help finding work, job training skills. Ready to Work is prominently featured in all of that, but as well as other programs that are probably partnered with Ready to Work. But we don't have a job board per se on Sacred, but I'm sure that there are links to job boards on Sacred. So even though we don't maintain those ourselves, we can help you find those.
Yeah, we're about to publicize a job board, and it's going to include every one of the target occupations that we have. So I mentioned there are 81 target occupations that are in high demand and that are well paid. we are doing scrubbing of all of the employers in the region who have those jobs so that we can actually list them for our coaches and for the public to go find those jobs. So we're it's not ready yet, but it should be ready within a couple months.
So my next question is to Bill and Amy, because Doug boldly, I kind of thought he would anyway, but boldly expressed his need, the need. And I'm wondering, Amy and Bill, from your vantage points, what needs do you have? Like Doug has spoken out from the other two directions.
I'll happily go first there. My need is to get to the people who need us the most. And this connection right here, what you're doing, Anne, is exactly the way to get there, in my opinion, because these people are touching the people on the ground, the voice. We need to be the voice of the voiceless. We need those people who need us the most in this program. And not only that, we need to have them advocate for them, because there are some hurdles that you have to pass to get through Ready to Work. You have to provide your documentation. You have to make an appointment with a counselor. You have to do some stuff online, and it might be intimidating. And these people might have been kind of beaten down over time, and they might think it's too good to be true. And, we need to help them, foster them along through the process and be an advocate for them through the process to make sure that they get served properly. We've got 10 different agencies that are providing the Ready to Work program. So it's a little confusing. You might get a call from Project Quest, or you might get one from Alamo Colleges, but it's all Ready to Work. And, we're here to help, but it's sometimes a little difficult. So getting to the people that we need to reach and then helping them along the way to get through our program.
So I think people might need to know a little bit more about how. So you're saying the need is to reach the people who need this help.
Yeah.
So how do we do that?
Well, one thing we found really well with the faith communities is that you let us come talk to your churches, for example. And then once we do that, then you have a point person in your church that can be kind of more of an expert on the topic. So an ambassador for Ready to Work. So they could ask that person and they could say, oh, well, you could call Amy, or you could look online and here's where you go. We have a really nice comprehensive website that tells you everything, but it's just that you need that warm handoff. You need that person to say, yes, you can do it. And it's not too good to be true.
Mm-hmm. Okay. And I think I heard in a meeting earlier this week that we were hoping that some people will even go door to door somehow.
Yes,
So
I mean, door to door is the
can,
clearest way. Yeah.
Yeah, if you can put, some contact information into chat, if somebody wants to volunteer more directly, or if they would like Ready to Work to come to their congregation or to an event to speak or talk and work together, that would be helpful. Bill, what needs does Sacred have that these other two can help with?
So, well, I've expressed our mission about, helping to connect people and to facilitate those connections. But, tactically, we do that in really two very simple ways, right? One is we collect and publish really great content in a very simple, easy to use format. And so that's done, right? And we have staff that maintain that. But second is we need people to actually look at it. So just like Amy's talking about, she's got a website that has all this information on it, but if nobody knows about that, then what good is it, right? So Sacred is the same thing. So what we do is we have a program where we can go out into the community and we can do trainings and orientation on what Sacred is and how to use it. We do that for individuals that work in communities, whether it be nonprofits or government programs or faith communities. We do that for the public, once a month via Zoom. And so really, I think that is, my need is just, I want to make sure that the people that are enrolled and Ready to Work, the people that are engaged with NAMI, the people that are in any organization that's helping their neighbors, know what Sacred is, and that those individuals can then self-avail themselves to that information if they want that. So we do that by going through and I would hazard to say that Amy wants the same thing for her clients, right? Is to be able to get the resources they want. So we could offer to, say, I don't, Amy, I'm going to call it a semester. I'm not sure what your training, time component is, but I'm sure there's an onboarding and orientation process at that, where everybody goes through. So there could be a process in there for while you're going through, a 1 hour or hour and a half presentation, while you're going through this process, here's sacred.org. So if you get stuck in something and you need help and
Oh, I love it.
use sacred.org to do that, we can do that for every participant and that comes through Ready to Work, and
Yeah.
make sure that they're aware of the program. We do something similar for NAMI. We have a monthly offering where Doug has, through his training program an education program for the Bridges to Care Wellness Champions, we have a regular monthly course where we talk to all those wellness champions about how to find resources. So we do that. We're shooting to do about 100 people a month, through this education program. That's 100 people that are working in some kind of capacity. For the public, we do probably another 200 people a month through public expos and resource fairs and things like that. So we just, if you have a group of people coming together that could benefit from that, invite us in, and we'll give some great information and do that. So that's what I need, and I'm offering back, that's a great help and assistance to your clients as well as to our operation.
Love it. I'm going to take you up on that. And just to
Doug?
clarify, and people coming into Ready to Work, it depends on where they start. So maybe they don't have a GED. We can get them a GED and then get them an associate's degree. If they're already coming in and they have a year of college, we can help them finish their college. If they want to do a trade school of some sort, it could be plumbing, it could be IT, healthcare, then we'll get them a trade certificate. So it's all levels.
Doug,
So-
you've expressed one need, and add some more, something.
Well, I was going to ask Amy real quickly, the educational institutions you work with in San Antonio, I assume those are listed on your website as well?
Yes. Yeah, we have a public, this is amazing. Oh my gosh, y'all should be so proud of our city of San Antonio. We have an online training catalog that shows only those courses that we'll pay for that are aligned with well-paying, high-demand jobs.
Oh.
So we have about 1,000 courses offered by about 90 different training providers.
Mm.
And it's
are
on our
you-
website.
Are you in questions in the chat? Is Ready to Work in low income schools? I mean, what's the
Yeah.
outreach in schools?
Yeah, so the eligibility is you have to be 18 years old to be in Ready to Work, but that doesn't mean that we can't be in the schools, right? So we are very well connected with the UP partnership, and this is another co-laboring concept. Everyone should be connected with the UP partnership if you're not already. We also, really the outreach there is to the parents as opposed to the kids. But once they turn 18, then we are helping them get into Alamo Promise. And then we're also helping them get into our program. We also are connected with Pre-K for SA and with the Head Start. You think about the parents, it's a dual gen thing. Same thing with the dual gen with United Way. Yeah, so we sure are.
And what about undocumented folks?
Undocumented, for our program, you have to be eligible to work in the US. So we do work with refugees that are documented, but we don't work with people who are undocumented, but we do refer them to the Texas legal clinics, and we look on Sacred for other resources.
That's great. So it's 8:28. I'm going to take just a little pause because our time, and we've seen some collaboration happen this morning, some movement, and that's exciting. And that's, I think, one reason the work is so exciting, because when you're in it and you start seeing and being these connections, we can move so much quicker, and the quality becomes better. We become more efficient, more effective, and we meet the needs. And in terms of a compassionate city, we lessen the suffering, the pain, what's needed. I think we haven't, although it's there, we haven't actually touched on the why, kind of the deeper why behind all of this. And so you might be thinking about that, and where each of you can point people next. But those who might need to leave at 8:29, thank you for being with us today. We're going to have a similar conversation next week, but it's going to be around resiliency hubs. We've heard about resiliency hubs, and we've got different things that are kind of shaping and forming out there that can maybe confuse us, because they're all calling themselves resiliency hubs. So we're bringing those folks together who work on resiliency hubs from different directions. And we're going to have another conversation about co-laboring together. So, are the three of you able to stay a little bit longer if you need to go?
Sure.
Okay, great.
Yes.
So, the why when it comes to, and I know Doug will have an answer to this, but when it comes to mental health, why is that job connection so important? And that's the same question for Amy and Bill. Why are these connections so important to the health?
Well, I think one of the things that we find with everybody is that when we have issues regarding just basic necessities, whether it's housing or food or employment or education, our stress levels go up significantly. And if you're a person who's already has reason to have a mental health issue, either because it's just in your makeup or because of it, if it's trauma, those issues surrounding kind of basic needs, they really exacerbate mental health conditions. So that's why we talk about a holistic approach to mental health care, body, mind, spirit, and I add community. But what we notice and what we see all the time is that when people have these basic needs satisfied, their medication actually needs go down, and they're able to move into what we call recovery. And recovery is defined by one of the peers I know is the ability to regain the parts of your life that you thought you'd lost. And your life, the employment, the family, the education, and all your basic necessities, those need to be there. So it's a big reason why we need to collaborate. And I would say that in San Antonio, probably most cities, we need to do a lot better job collaborating among nonprofits and people who are dealing in these social determinants of health. We need to do a better job so that it's not as hard for people to find the things that they need to remain stable and remain part of the community and engaged. That's when we do best.
Mm-hmm.
If you permit me, I want to share my screen for 1 second to show you the comments that we got from our provider here. So
Yes,
we have an evaluator who's running around asking people who've been in Ready to Work and asking them for, how has Ready to Work and your new job impacted your life so far? I'm more assured. Like, it's better, it's good. I've caught up with my bills. I have money in my wallet. My bills are paid. I'm up on everything. Now I can enjoy the fruits of my labor. So yes, my stress level is going down, right? And here's another one. I was stressing in my previous job. I mean, this is mental health we're dealing with, right? So there was inconsistency, miscommunication, disrespect. I was a burden to my husband and I was venting to him. He didn't want to talk about it, but he wanted to be supportive. As soon as I started this job, it's gotten a lot better. There's nothing to complain about. And when I work, it's positive. I feel professional and respected, like that kind of stuff. This is major.
Mm-hmm. Mm-hmm. I've heard comments too, and I know Bill has, but from adults, right?
Yeah,
who first discover sacred.org, and they say, when I was a kid, if we had had sacred.org, my life would have been totally different.
Yeah.
I want to hire that person. So we find that
we all do.
We find that people that come to work for Sacred, the best resource investigators we have are people that have had some kind of lived experience where they've been out seeking assistance somewhere along the way, and they just know how to find stuff, right? Because they've had to do it for themselves, and so now they do that for Sacred, and they're really good at it, and they know exactly what kind of information needs to be communicated to other people because they've been there, and so we hire as many people like that as we can. But the I think there's, from a job standpoint, I mean, everybody has to have some purpose and meaning in their life, right? And most of us most of us during our prime years can't just sit in front of the television, and you can only play golf so much, right? But and so we got to have something to do, and most of us need to do that in exchange for money, right? And so that so having a job is kind of key, and being able to do that in a way that brings purpose and meaning is even deeper, if that's possible to you. But one of the things that we see at Sacred about people that use Sacred is that they have this kind of it kind of restores this kind of self-determination and independence to individuals, because because now there's a place to go where they can find help that they're looking for, or find a place to go to get the resources that they need, without having to call somebody and fill out a form and document how poor you are over and over and over again. Right. And so you can come to Sacred, you can look up the information, you can decide when to act on it and how to act on it, and which piece of it to act on, all on your own. And if you want to get assistance, then you can also find that through Sacred. If you want a case manager, you can find that through Sacred as well. But it really brings this kind of self-determination to finding assistance and finding the resources that I need to move me forward in my life where I want to go. And so I think it's a great thing. So,
and I'm thinking, Doug, when it comes to like the training that comes with Bridges to Care, the 20+ hours, no cost training, mental health training, what are some of the things that you see from that? What do people say about that education that's received?
Well, I think that maybe one of the most common reactions is, and we see this when we talk about signs and symptoms of a mental health issue. So oftentimes, if you're in that educational group, in that class setting, you think, oh my gosh, that's my spouse, that's my son, that's my daughter. This recognition, and for years, many people will have seen these behaviors that they didn't necessarily, they weren't great. They didn't know what it was.
Mm-hmm.
And I think one of in our NAMI classes is such a relief for families and for peers to find out there's a reason why maybe I didn't feel well. But I think what we really work on is recovery. Recovery is possible. Many people think that, well, if you got a mental illness, that's a lifetime sentence and you're done. That's not true at all. And the things like finding a job, having a job is one of the most, like Bill said, having a sense of purpose changes your whole perspective. And I would venture to say that most of the people I meet who are peers, people living with a diagnosis, they want a job. They don't necessarily want benefits. They want to be productive. They're willing to give up their benefits, Social Security benefits, in order to get a job. But we've made it very, very challenging for people to kind of climb out of that hole if they have the benefits, because the more they earn, then the more benefits they lose, and they never make enough to be able to kind of reach that level of stability, either making payments on an apartment or. So employment is such a key part of this. It addresses so many issues. And I think the other thing we find with employment and being socialization is a big part of that. Being in a community, when people are together, they do better over and over and over. So that's one of all these byproducts come out of what we think of as a job. Well, it's a lot more than a job.
Sam has his hand up.
Yeah, I just wanted to mention, I'm very thankful for the 3 people and what they provide. I use Workforce Solutions to my ambassadorship. I was one of the first ambassadors in San Antonio through the program. and we send tons of people over there every week. When we did a resource fair down at our campus at 1616 Commerce a couple months ago, you know, I had a tent there, and it was the three people that take all the ambassador. So when I went up there and I introduced myself, yeah, I'm Sam Gomez. Oh, man, you're that guy that sends all those people to us. I think I sent like 100 people in one month or something.
Thank you.
And they were like, man, thank you so much. I said, man, I'll keep sending hundreds more, you know. And then as far as Bill, I mean, God, we just, you know, sacred's everything to us, you know. I mean, I have a quick story I want to share about 2 months ago. A girl came into the office at Revis, and signed her up for our program, the Family Health and Wellness Program, where we get free diapers and wipes to clients who have children under 3. And she was saying, well, you know, Ms. Gomez, well, you know, I need some rental assistance, I need some utility assistance, and, you know, and I need some food. So I got her on Sacred, you know, she had her phone, but I turned my camera, you know, my little computer around. I showed her how to get on, put the zip code, is how you do it. When she came back the next week for diapers again, and she was like, oh, Mr. Gomez, you won't believe. She goes, I got assistance with my rent. I got my utilities paid. I was able to get some food. I was like, man, that's awesome. You know, oh yeah. And so many people come back all the time telling us about, I mean, when I first met Bill, I remember when I first opened Sacred for the first time, I remember the number of resources was like 3,000 something. I mean, they're almost reaching 10,000 resources. That's like crazy. And then, of course, like with NAMI and them, you know, my whole staff now, being that we do probably more domestic violence classes than we do parenting classes, you know, we're taking advantage of all those free resources out there for classes. You know, right now I got a few people taking the ACEs training tomorrow. I myself have gone through a lot of, you know, implicit bias training and, you know, trauma-informed care training through me and some other organizations here. So yeah, and everybody's here that's in the meeting today. If your staff deals with, you know, these populations and so forth, take advantage of all that. I mean, because these 3 resources that are here today, these screens are huge. So I know I take advantage of it. So I want to say thank you, because we use you all the time. You guys are great resources.
I think too, if we need to bring this to close. So I'm going to ask next, the 3 to point us to something next. But, you know, if we're honest with each other as well, right? Not everybody gets into a job that necessarily gives them a full life purpose, right? And that's just our reality, right? But one of the things that I have noticed, especially, well, with all 3 of these, but I'm thinking mostly about the training, like through Bridges to Care. I mean, I don't know what the number is now. I think the last time I heard the number of San Antonians was something like 800 people had gone through this no-cost training. And no matter what their jobs are, right? Suddenly they're equipped with tools that bring them purpose, no matter where they are, right? So in their congregation, but mental health tools they use at home or to use at their office that might not be a healthy workplace, but it's what they got, right? But suddenly they have a way to engage in places that are a struggle, but with some equipment. And Sacred is part of that equipment, you know? And so it's just, you know, Doug, you're right. We're just better when we are together. And that's collaboration, that's healing, that's strength, that's resiliency. I mean, we can, all those things. It's community.
Creativity. Yeah.
It provides us hope. So in these last 2 minutes, can you each point us to something that others here might connect with you, go to? Who wants to go first?
I can start on that one. So October 21st, we're going to have an event at Memorial Library on the west side. And we're partnering with the library system to make sure that everyone there is fully aware of all the opportunities with respect to Ready to Work. And then we also have October 10th, we're going to have a community champion collaborative. The next one is focusing on serving people who've been involved in the justice system. So I'll send Anne information about those and she can spread it out to the network, but be on the lookout for those 2 events for me. Thank you.
Okay. Doug, Bill?
Well, I'll just repeat it. October 7th, the NAMI walk. You may kind of wonder, you may think, oh, that, go out to a walk. You will love it because people are there and you're going to see people and you didn't realize there were so many people that wanted to be working on mental health. The other thing I'll say is we have Bridges to Care classes that are going on all the time. And I think the companionship class is one of the most important classes we teach. When you talk about people, how do we find meaning in our lives? Learning how to walk alongside somebody who's going through a difficult period, whether it's a mental health issue or a family issue or a career issue. Learning how to walk alongside somebody is one of the best things we can do. And we can talk about gratitude all day long and how it changes our brain chemistry, that when we reach out and help other people, we do better, we get better, we are better.
And Bill Neely.
Yeah, I'll echo Doug, and the NAMI walk is a great event, and so this is not like, I don't know if any of you have done 5Ks or other walks. This is not where you like go stand in a whole crowd of people and you walk down a street and this is not a march, right? Or you basically get into the zoo and you can walk around the zoo. So there's, so maybe there's a path marked or something, I don't know, but you get to walk around the zoo and it's just a great time. And I had such a good time last year, but anyway, so please do that. But at Sacred, we offer quarterly user groups. So what we do is once a quarter, we invite all of our users together, and those could be individuals from the community, nonprofit employees, government employees, faith community, volunteers or workers. And we just invite them to come in and that's an opportunity that we give our users to come in and say, hey, Sacred is doing a really good job on this and this and this, but I need this extra feature, or you're not really helping me with this problem I have. Is there anything you can do about that? And so we take suggestions, we take compliments, we take criticism, we invite criticism. If we're not meeting something, we need to know about it so that we can do it better. And we also use that as an opportunity for educational purposes. So I'm going to put a link in the chat. The next one that comes up is next week, September 21st, Thursday at 11:30 in the morning. Till 1 o'clock, and it's at the Meals on Wheels headquarters at right around 410 in Nacogdoches on the north side. And so we're going to be having a panel of best practices for Sacred that have been adopted by organizations and how they're using Sacred within their organization to make their service delivery more effective. And then we're going to do a mental health panel. And so NAMI is going to have somebody come and we're going to talk about mental health 101. And so if your organization doesn't have a mental health practice, but you're encountering people that need mental health assistance, you can come to this event and you can hear from NAMI what you can do in your organization to handle those people that you're encountering in a useful way. So sign up for that. Free lunch, if you come. So there's always that.
Food is always good.
Yeah, it's always good. 8:47. I just want to bless everybody on their way. Keep co-laboring. Just keep swimming, right? Just keep working together. And
Thanks for this opportunity, Ann. It's really great.
Thank you all. Have great weekends. We'll see you next week when we co-labor about hubs in our city. Take care.